You're listening to Travel Nursing and Allied Life, hosted by TravCon.
Welcome to the Exhibitor Minute of the Travel Nursing and Allied Life podcast. I'm your host, Michelle Freitag. This week, we'll be discussing the changing priorities of healthcare professionals, how the staffing shortage is affecting them, and what different directions some are choosing. Welcome back this week, Valerie Gale. If you tuned in last week, she talked about clinical coaching and different specific issues that travelers have had on assignment and how she managed to help them work through it. It's in a completely separate entity, not even separate, but a completely its own entity within Nomad, so that if you have any issues, she can help you coach through them. So I encourage you to tune into that podcast if you haven't listened to it already. And this week, thank you very much, Valerie. Welcome back.
Thank you. Excited to be here.
Talk a little bit about how the priorities of healthcare professionals have changed since before the pandemic. It's been a very different scene for everybody working through the pandemic, but tell us a little bit about how it's changed from before to now.
Yeah, no, thank you so much. I think what we are seeing the most, and again, this comes through many of our clinical coaching calls, is where we really kind of hear the heart of our HPs coming through. But we really are hearing this changing priority, and I maybe it's a little bit hard to say it that way because I think it's always been a priority for us, but I think maybe just a re-energizing around mental health. And I know that we've seen that in so many other parts of the world, really, and so many other businesses and in athletics and sports, and just this awareness, creating an awareness of the reality of mental health and the challenges. And I think it's obviously not been any secret, the burnout and just the frontline work for so long that just felt relentless, right? That you would think there was a light at the end of the tunnel, and then it would be a train, and it was never going to stop. And so what we have heard, and I have seen and heard this shift even just in recent months, like I'll just say even over the course of 2022, is just this real desire to be in a place where an HP feels safe, they feel heard, that they don't feel like they're called to compromise. Much of the data I think that came out, again, back in the voice of the travel nurse, data out of Gypsy Nurse, is just so telling. And we're hearing that is that the priority is really on, I need to protect my license. Yes. I don't feel good doing this the way I'm doing it anymore. And so just, to steal a line from last week, we coach to stay, but not to the point where a clinician doesn't feel safe, right? When that is their priority and we really resolution, then we'll coach them through that and look to find them another assignment. And so I do think that that's just a huge priority, or like a re-energizing around mental health and the need to protect it. And I think too, like the statistics around just leaving the workforce before the pandemic was like right around 11%. And this is nurses specifically, so I don't need to exclude anybody, but that's just where the research sits, is like almost 30%, like 29% are leaving the profession.
Wow.
And so I think that's scary, and it's kind of sad. And I think, one of the other things to think about is then where are they going? And so I think the hope in that, or the glimmer of hope, the flip side of that, is I think what we are seeing is, even as healthcare professionals are exiting maybe from the bedside, I think that can be interim changes too. That can be, I'm going to exit we have a fantastic account manager on our Nomad team. And she was a baby nurse, graduated in 2018, and just had to step away, in 2021 and say, like, I need to take this space, and took 6 months and said, I'm not sure what I'm going to do, but I can't do that right now. And so there's this like priority around getting the space and doing the grieving and doing the recovering. And I love that, because I think for too long, a lot of us just kept, this old memo that says you just can't stop, right? You can't stop, you can't heal, you can't recover. And I see that rising as a higher priority. And what I see then is nurses and allied health professionals that while they may exit the bedside, they're still looking for ways and roles where they can really influence and impact healthcare, which I love that.
Exactly.
And
Because
so
that's
like I
what
think
they're
our
in
team,
for.
right?
Yeah.
Yes. And
That's
I
what
think
they love.
that
Sorry.
no, you're fine. That I think that's what makes a difference, right? Though it's again going back to some of the other conversations we had. Someone gets two extra patients and it's 2 o'clock in the morning and now they're 10-to-1 ratio and they're like freaking out. The next morning, you can tell that story to your spouse, you can tell it to your partner, you can tell it to one of your kids, you could tell it to an employee. That if you can talk to a nurse or you can talk to someone that says, "Oh my gosh, I've been there.
Yeah.
I have so been there." And like we've had tears, like we've had folks on our team that end up on a call for 60 minutes. And those are again those meaningful moments of connection that that allow clinicians to feel validated, to feel heard, and they're being heard by another clinician. Mm-hmm. And I think that really does seem to make a difference. So that priority again around mental health, around connection, a willingness to speak up. I love that. I mean, I remember the years of trying to force people to speak up if they saw something that wasn't right. I mean, I did patient safety for lots of years, and I just don't. We don't have to do that. It doesn't feel like we have to do that as much anymore. I feel like people are much more willing to say, "No, I'm going to speak up now." So,
and that's very powerful, both for patient safety and for healthcare professional mental health, because they are willing to stand up. You see a lot of the discussion, hey, I'm a little burned out where I'm at, and I recognize that, but I also love what I do still. So what other options can I use? My training and my experience, I still like certain aspects of this. Where else can I go? And they're looking for different options. You see that a lot. We had at TravCon this year, we had a talk on remote nursing, sort of remote telehealth. That was one of our most popular sessions. Also adding things like RV living or van life. That whole new revitalizing element into your travel nursing adventure or travel healthcare adventure. So being able to add that can be huge. How do you think the growing healthcare working shortage has impacted those that are still in the field? I mean, it's more stressful. It's they're dealing with, like you say, higher ratios, and thankfully California still has its strong union, and they're fighting hard to keep those ratios intact, which I think helps the rest of the country. But there's still a constant battle for those who are in the field. What have you heard from them, and how are they getting impacted?
Well, I think, or you sort of alluded to it yourself, but I mean, anytime you remove supply, right, the conditions just become more challenging. And so I think that's the unfortunate part of our industry right now, is that the aging population won't stop, right? So that trend is continuing. This dramatic increase from 11% to 30% of the exiting of the profession. We also know there's a huge impact coming from physicians, right? We know there's a physician shortage and education programs. And how can we creatively, are there other ways to do education and training? And, we were just at another conference a few weeks ago, and the whole conversation around the team-based model of care, right? Coming back, how that comes full circle, where now it's, one RN to a team, and then these are all the other people you have on your team, and everyone's operating at the top of their license. And I think there's so many conversations now in motion about how to do that, because I don't know that there's relief any other way, because again, until we create spaces that our nursing and allied health professionals feel safe and confident, and all of that staying in, I just don't know that worker shortage is going to stop. And I think it's incumbent on us as leaders in healthcare to look for ways to stop the bleed. And if we listen to what people are saying, and even we listen to ourselves and what we need, again, it just goes back to healthy connection, to having hard conversations, to building things right from the beginning, and fixing what's broken. And that can't always mean more people. Right. So if it can't always mean more people, what are some strategies we could do to address it? I
With
wish
the
that was more positive answer, but I just don't think it's going to get better, at least not in a hurry. So
do you see the team nursing coming back, or the team healthcare? It's not just nursing; it's
right.
PTs helping working with PTAs more, and
Yeah.
OTs with OTAs, and using sort of, as you say, working to the top of your license. Do you see that coming back to a
We've
lot of facilities?
So I will say that I've definitely heard that conversation more again
Oh,
than
I
I've
see.
heard it in a really long time. And so we were at a conference a few weeks ago, and at the Becker's healthcare conference, and that topic came up a couple different times. Is again, how can we creatively address this? If it can't just be more RNs, or it can't just be more doctors, how can we look at licensure requirements, and how can we look at who does what? Again, 30 years ago, well, maybe not 30, 20 years ago, when it became so, think about respiratory therapy and the role of the respiratory therapist in the ICU and what they could do in the settings on the vent versus what the nurse can do. And, can we craft systems of care again, which really promote everybody operating, like I said, at the top of their license?
Right.
And I think to some degree we are going to need to reevaluate the role of some support positions. We think allied health already is 60% of the healthcare workforce. Right? That's a meaningful portion of our healthcare workforce. And so, is there opportunity for more? I think we're going to have to be creative and entertain models that have worked before.
We really are. I do notice the latest hospital that I worked at, they were very quick to cancel sort of the aides. They kind of felt like that was somewhere you could shave off. But everyone at every level is so important in the team.
Yes.
And aides, or whatever you call them in whatever area you're working in, they can answer call bells. They're reducing falls. They can take vital signs. They can check in on people. And that is a huge portion. That's actually, checking in on all the patients regularly. That's a really satisfying but valuable part of the care.
Yes.
When you
100%.
hear a patient say, I haven't seen anybody in hours, I mean, that's really hard to take when you hear that. But it's simply because you're short staffed. So if you can bring the team in together and utilize, yes, you as a PT, OT, RT, as a nurse, you might have more patients on your docket, but you might be doing less or the same work because you have help, you have assistance.
Yes. Yeah.
Physicians have residents and whatnot also to help them with that. So that might be part of the solution to the shortage that's happening right now. But as you say, it's nice to see that travelers are willing to speak up and say, this isn't a safe assignment, this isn't a safe area. Or I feel a lot of animosity from the staff. They know there's another job around the corner because they can move to different places. So the voice of the traveler really said, these things are important to us. We're not afraid to work hard.
Yeah.
Money is not at the top of the list. It's important that it's not at the top. What really matters is the team approach, the support I get from my coworkers. And, I think those assignments will be more popular because they can offer that.
Yeah, no, I totally agree with you. I think about the OR model. If we think about something that's remained relatively stable in healthcare, like you would never think about taking the scrub tech out of the OR, right? And to your point, every member of the team in that OR has to be there. You need the circulator, you need the scrub tech. You wouldn't go, and we need to cut, so we'll take rid of it. But for whatever reason, that approach to making sure everybody is able to do, again, what they were intended to do and do it well and do more of it, we don't translate that into other nursing units and other units of the hospital. And so could it, is it something that we could start doing again? It's, those things tend to come back around again, just like wide leg pants. So
I feel like travel nursing also is its own antidote for mental health because, and I'm talking sort of from a staff nursing point of view, you get very tired in your regular role and you're sort of limited in your growth, your clinical and your mental growth. And so much when we give scholarships to travelers every year, those that are improving their communications. One of the questions we ask is, how has travel nursing helped you grow as a person and as a healthcare professional? And they talk about, it has expanded my horizons, both clinically and mentally, but how people do things different from one country to or one state to another state, how things are approached, how things are taken care of, how the patient, care changes. And so for them, even if it's not permanent, even if you're only as a healthcare traveler for a few years or 2, 3, 5, 10, it revitalizes your interest and desire to do what you love doing, because it changes, it's fresh, and it keeps moving. So we see that a lot for people moving from the staff position to the healthcare traveler side, and they love it, that added excitement, and they might go back. Most people will go back to being a staff nurse, but what they gain from traveling is indispensable.
Yeah, no, I mean, I can see that, right? Because even if I think about taking a break, like I think about people after they come back from vacation, so they take a week away or 2 weeks away, and they've had a chance to disconnect and refresh, and like they come back and they have like this new energy, right? And I say often, like, most of us are really great starters, very few people are good finishers. And so I think that doesn't mean we can't be. It's just there's just this natural human tendency for things to kind of wane, right? And so our mood to wane and our engagement to wane. And if you've seen the same issues ongoing and there's no resolution, that can get frustrating. And so it's not to say there's not going to be issues somewhere else either, but giving yourself that break. And I think you're right. We have seen kind of a cyclical, again, approach to travel nursing, where it's, I need to step away for a while and I want the variation. I don't want to grow that way. And then there's a maybe I need, I want to go back. Or we have HPs that extend their assignment 3-4 times at the same place and then decide, I want to stay here. I really like it here, and build relationships. And that's great, right? I mean, that's really what you want.
It's the opportunity to shop around and test it out and decide, yes, this is where I want to lay down. Yeah. I think the creative approach to internal resource pools are probably to address some of that also, right? With some facilities that are looking to build those types of things internally. And so again, I think that's a human need that all of us have for those periods of, just renewal, and to get reinvigorated and see life a little bit differently. Going back to, our team, that really is the role of our clinical excellence team. As I have thought about it, my role for, as the leader is, we need to be providing to our HPs the same training, education, opportunities for growth, leadership, education that we would if we had walls around our work. We just don't, right? So we have units in hospitals and ORs, and we have those in all different states and everywhere. But if we were Nomad Hospital and we had walls, what would we do? What programs would we have? And so I love that question to HPs, is how has travel nursing really expanded you and grown you and allowed you to flex different muscles? And, I'm just really feel privileged to be a part of trying to do that for a workforce that, again, I think is filling needs and standing in the gap, and they're on the front lines every day. So. Very good. Thank you so much, Valerie, for sharing your wisdom with us. It sounds like you're doing wonderful things over at Nomad. You can find Valerie and her team at nomadhealth.com. So we'll have that in the show notes below if you need to. And thank you so much. We will see you next week.
Awesome. Thanks, Michelle.
Thanks for listening to Travel Nursing and Allied Life. You can find the full show notes below or at travcon.org. Please help us out by rating our podcast on iTunes or wherever you get your podcasts.